Hello, and welcome to MIR, the University of Michigan-Flint School of Nursing Simulated Electronic Health Record. The first screen you will see is the login screen. Simply type in your initials and press Enter. Now we can select a patient. From the sidebar, click on the clipboard icon. A list of patients sorted by last name and first initial appears. Scroll to the patient you wish to select and click on their name. We will be working with Mr. Larson. Now we are on the patient's chart. At the top of the screen, notice the patient's info block. This block appears on the top of each tab and is always available. Here you will find important information such as the patient's name, birth date, MR number, and any allergies. Also listed here is the room number of the patient and the physician in charge of the case. This is who you would call if you need to contact the doctor. The chart initially opens up to the Patient Information tab. This contains general data about the patient, including some notes about their present illness and medical history. Next, let's click on the Physician's Order tab. Here we find all the orders that have been put in for this patient, as well as all the medications prescribed. Scrolling down to the bottom of the list, we see it is possible to add a verbal order if necessary. During simulations, this is usually done by the physician remotely. Next, we will head over to the Medications tab. At the top of the screen, the chart reads Patient Not Scanned. Scanning the patient's wristband with the attached scanner will update this. Note that you must click on the OK button in order to scan meds. The medication orders are listed below this. There are fields which show the date the order was put in the computer, which medication is ordered, and the dosage, route, and frequency. Also listed is the schedule on which the med is to be given. Please be sure to consider the scenario time when delivering meds. It may be different than real time. Medications can be scanned. Once this is done, a separate window will appear, allowing you to update the status of the medication and input any notes that might be appropriate. Please be aware that for the functionality of the page, it is necessary for it to reclaim the cursor from you. It may happen while you're typing a note. Simply re-click in the notes input box and you will be able to type once again. Please click Submit when you are done, and then you can scan additional meds. Please note how our medication status has updated. On the Labs page, any testing results the patient has will show up here. Lab results will be grouped by panel and contain a reference value. A red flag will appear if a test result is outside the reference range. During the scenario, multiple lab repeats can dynamically update if available. The Imaging tab contains reports about scans the patient has received. If an image for the report is also available, click the Show button to see it. You can click the Hide button to remove the image from the page. Here on the Vitals screen, we see the patient's recorded vital signs. A new set of vital signs can be added by filling out the appropriate boxes and clicking Submit. Not all of the boxes need to be filled in order to add a new set of vitals. Note that if you do not click Submit and navigate to another tab, your vitals will be lost. Below the vital signs table are a number of other tables for inputting sets of patient information. At this time, these additional tables cannot be permanently submitted to the chart. This page is a record of the patient's intake and output. The first table shows a visual representation of the intake compared to the output over the past day. Below that is a table logging the various intakes and outputs, starting from the first record and descending towards the most recent record, totaling the value at the bottom. New intake or output records can be inserted at the bottom two tables. Once the information has been input into the text boxes and the Submit button is clicked, notice that our graphs and tables have been updated above. Here we see the notes pertinent to this patient's case. Notes are grouped by discipline with an additional set of generic notes regarding the patient's progression. A new note can be added for any discipline on this page. Notes can be collapsed or expanded by clicking the arrow on the tab. On the Docs tab, we will find relevant documentation and forms for this patient, blood transfusion records, discharge forms, and any medication-specific protocols are commonly located here. Once you are done working in a patient's chart, you can log out by clicking the X button on the sidebar. Thank you.